Okay, terrific. Again, thank you so much for coming to our webinar, for joining us today. Introduction to Access Health Connecticut for Community Partners and Renewals. Today, I will be your moderator. Again, my name is Evelyn Mantilla, and I work with Grossman Hines. And I am pleased to have with me Rachelle, or Shelley, as we commonly refer to her, Pierre, who is the outreach coordinator here at Access Health Connecticut. Shelley, is it okay if I refer to you as Shelley throughout it? I'm going to pass the webinar right on to you, and we will have a good conversation with our participants today.
Hi, everyone. Thanks again for joining. Just getting right into it. For those of you who are on the call that may have been with us since day one, thank you. I can't say thank you enough. So you may know a little bit about this, but for those of you who are new, buckle up and let's go. So a little bit about Access Health. Our main mission is to get Connecticut residents covered. We want to increase that number every year that we're open. We want to retain current members in their plans and guide them to the options that are suited best for them, but also educate them on how to use those benefits once they enroll. We also offer the lower costs with the subsidy for those who qualify, and we're trying to eliminate health disparities. Access Health, remember, is the only place that individuals can become eligible for financial help. Financial help, sorry. That is the tax credit, the advanced premium tax credit subsidy, all referred to as the same thing. But unfortunately, in our fifth open enrollment, we find that there's still some confusion about who we are and what role we play in the process. Access Health is not an insurance company. We are the marketplace. We house the application, the portal that people can come on to and shop for different plans. Think of it almost like a one-stop shop. So we guide them through the application, we shop through different plans, and we ultimately help them enroll. So that is our role. We offer assistance that is free, always free, either online at our website at accesshealthct.com, through our call center, or even in person. And this year we have 10 sites and 5 enrollment fairs. So all great ways to get in touch with us so that we can get you covered. Again, I cannot stress to you how much we are here to help, and it's not without your assistance as well. For those of you who touch the community a bit closer than us, it is important to remind consumers that Access Health is not just for those who are not insured. Maybe you have health insurance and it's not affordable. You want to shop other options. Maybe you just lost your job and you want to see about a different way to get covered. If you're self-employed, there's still a way to get covered. The misconception is that Access Health is only for those who do not have health coverage. No, that is not true. So just always push your consumers to at least see their options, complete an application, and see what's available to them. With your help, we have been able to bring down the uninsured rate down to 4%. And as displayed here on the screen, our qualified health plan enrollment as of October is over 95,000 and Medicaid nearly 700,000. So great work, guys. This is our song until Christmas. Open enrollment does not end until December 22nd. So this will allow you to have coverage starting January 1st. It's much shorter than it has been in the past. So please remind everyone to get online and enroll today. This year, the marketplace offers plans through Anthem and Connecticut, offering bronze, silver, and gold plans, and of course, year-round enrollment into Medicaid Huskies. Again, we are the only place that will offer financial help, and close to 80% of our customers receive either a subsidy to help pay for their health coverage. The misconception is that people think that if they make too much, they may not qualify, so they don't even bother. As you can see here, for a single person, they can make upwards of about $48,000 and still qualify for assistance. And that goes all the way up to a family of 4 making a little bit over $98,000. So it's always great to just get online, complete the application, and see what's available to you. Now, when you're helping your consumers through the process, This is just a great tool to help you remember how it goes and just assure them that it's not as complicated as it may seem. The first step usually is anonymous browsing. They can get online, punch in a few figures just to see what is available to them. Then the next step would be to actually go into the system, create an account, and complete our application. At the end of that application, we'll have an eligibility determination page, which tells you what you qualify for based on what's in the application. At that point, the client can then move on to our shopping screen, select a plan, and at that point, Access Health will or may prompt them to submit verification. Now, many people are very, very educated about our verification process. So our system may ping you for one of the three: identity, income, or citizenship. So once the consumer satisfies this verification request, Access Health will then release the policy information, the enrollment, to the carrier, which is either Connecticut or Anthem. So at that point, they'll begin to receive a lot of communication from them. But it's always great to have this checklist handy, either in your office or to your consumer. The most asked question is, what do I need to get through this? This is just a short checklist. It helps with income, the tax return, current insurance coverage if they're shopping to compare plans. Obviously, we need their social security numbers and other personal information or any immigration documents that may be relevant. Again, as I was saying, after the enrollment, it's great to kind of prep your consumer on what's to come. That way they're not kind of left in the dark. So upon enrollment, Access Health will shoot out a confirmation letter, just kind of saying thank you for applying with us, and we recognize that you completed enrollment. At the same time, whoever they chose to enroll with, either Connecticut or Anthem, will also send out some sort of confirmation welcome letter to the client. So just let them know that that's to come. After that, most of the communications will come from the insurance company directly to the client. First, you'll see the bill, which is the first month's premium, and their coverage will not become active unless they make that first premium. So please be sure to remind them. It's very important to take care of that. Shortly after, they could receive their ID cards, and then maybe not too long after that, they'll receive some sort of booklet or pamphlet, just kind of detailing who's in their network, what pharmacies and providers they have access to using that coverage. Always remember that we also offer dental coverage. I know we don't speak about it much, but it is there. The Affordable Care Act treats dental coverage differently between children and adults. For children, dental coverage is an essential health benefit, which means it must be made available either as part of a health plan or standalone plan. However, insurers do not have to offer adult dental coverage as part of their plans. So for anyone who does not have a dental coverage as an adult or wants increased benefits can come onto Access Health and shop through our plans at accesshealthct.com on our landing page and click the Need Dental Insurance tab. It is very important to note, though, that if the client is eligible for a tax credit, it does not apply to the dental coverage. So just make sure you make a point of mentioning that. Again, Access Health is here to serve the community and help in any ways that we can. We offer the assistance online, or access online rather, at accesshealthct.com, where people can go and enroll on their own or shop and browse or just learn more about what the heck is going on with my insurance or insurance that's offered in Connecticut. Another great way to get in touch with us is through our call center. The number is listed on your screen. And lastly, but not least, we have in-person contact. Again, we have 10 enrollment locations this year, statewide, located in Stamford, Bridgeport, Danbury, Milford, New Haven, Norwich, New Britain, Hartford, East Hartford, and Waterbury. We have 5 enrollment fairs this season, 2 of which have already passed, but upcoming for the 3 Saturdays in December, we have New London on the 2nd, Hamden on the 9th, and Willimantic on the 16th of December. So great ways to direct your consumers to in-person help. And of course, we have our brokers and certified application counselors all over the state available year-round to provide enrollment assistance. Cannot stress enough. Please remind all your consumers about this penalty. It's not to scare them, but yet to motivate them. If they are on the fence or are kind of dragging their feet on completing the process, just remind them the tax penalty is either $695 per adult or 2.5% of their annual income, whichever is higher. So just inform them, keep them educated, and kind of prompt them to at least get the application done so they can start the process and avoid the penalty altogether. Again, open enrollment ends December 22nd, but that is not the only time that people can enroll. Firstly, Medicaid is offered year-round, so please be mindful of that. But for those who may experience some life-changing events, there is something called special enrollment period. So some of the events that qualify you to enroll beyond open enrollment would be marriage, divorce, having a child or adopting a child. If you just moved into the state, lost coverage through your job, or perhaps you've aged off your parents' plan. All ways you can get onto the exchange outside of open enrollment. If the client is unsure, the best way to find out is just to call us at our call center or log on online and see if they're eligible. So again, just to emphasize, we have a lot of in-person help locations statewide. Again, those are the sites listed in detail with addresses. They have great hours, so if your office or if you cannot help with the enrollment yourself, please send them to one of these sites so they can get the proper in-person help that they need. As mentioned before, we are hosting 5 enrollment fairs this year. The next ones up are all in December. Again, there are the sites with their detailed address information. And it takes a village to raise a child. Yes, it takes all of us to get people enrolled. So this is just a map just showing the statewide help for all of the people that are involved in this effort to keep Connecticut covered. Renewals. Now, this may be a confusing topic for some because some of our clients are signed up for auto renew, and some people have to take a more active approach on their account. So what the best thing to do is to guide your client to get onto their account and make sure that they don't have to update their application at all. This can include income, address, or maybe something in their household may have changed. It's always good to keep the application as updated as possible so that they are quoted the correct rate. Again, this year we just want to kind of map out for you how many people we have covered this year. So again, thank you for all the help. This is a great job to everyone involved in the efforts keeping Connecticut covered. Just some more information to add about renewals. The consumers will get communications from us through various channels. In email, they may be prompted to go shop or use some of our comparison tools online just to make sure that they're still in the best plan that's for them, whether it be the metal tier, bronze, silver, gold, or maybe they just need a new plan altogether that covers some of their medical needs. Another important thing is to make sure that they've satisfied all their verification requirements. This sometimes could be a huge obstacle if not attended to immediately. So avoid getting any interruption in coverage, guiding them to make sure they've submitted all the required documents to make sure that they continue receiving that financial help, that subsidy. This year, we have continued our campaign just to educate and keeping people informed about their coverage to re-enroll and how to use it thereafter. So you may have seen our commercials on television. You may have heard us on the radio. We're just trying to keep everyone covered and informed and just making sure they stay educated.
Terrific. Thank you so much, Shelley. I really appreciate, on behalf of our partners, this information. I'm going to take over from here and finish the webinar, uh, particularly by talking about the opportunities to partner with Access Health Connecticut. Those of you on today's webinar may already be partners with us by helping us disseminate the information. If you are not, we do want you to join our long list of partners who work very hard across the state to make sure that all individuals and all families that deserve to have the information about enrollment are able to enroll. So let me tell you a little bit about what a community partner is. Partners share information about Access Health coverage with communities all over Connecticut. We provide resources and invite dialogues with our partners, and our partners include, here's an example list of the types of organizations that have joined with Access Health Connecticut to disseminate this information and help people enroll. Community health centers, we have educational institutions, we even have state departments like the Department of Labor, many elected officials, healthcare providers, health departments, hospitals, libraries, and faith organizations, and of course, many others. This is just a sample list of the types of partners that we have been able to engage with. So those of you that are already listed in our partners, we really appreciate it, and we always look forward to continue to working with you. Here's a great picture of where our reach is extended by working with community partners. Of all of those, this is a sampling of everywhere that we are in the state of Connecticut, and we never stop. We continue to look for organizations, groups, neighborhood organizations, anyone that may be able to help us have a further reach into the communities that they serve. What do we mean by partner engagement? We can be helpful to you, the partner, in a number of ways. For example, we can speak at your events. We can provide information and training sessions. We can send out the outreach team to your events to table, disseminate information, and have conversations with the folks that you serve. Access Health Connecticut also hosts educational webinars, exactly like the one that we're doing today. And the community website, which is one resource that I think is extremely important. I really would love for you to pay attention to this website at learn.accesshealthct.com/community. The reason why I want you to check out this website is because it offers information about a myriad of things, including events, our newsletter. It allows you to print our educational materials, which we make available to everyone. And of course, give you contact information for the different Access Health Connecticut departments that you may need to be contacted with. We also provide materials to distribute to your community. That is another way in which we continue our partner engagement. Some ways that you can help us spread the word include placing an Access Health Connecticut poster somewhere visible to your members and to the public. You can also display Access Health Connecticut open enrollment brochures for your community. Many of you may have already seen and have been delivered some of these brochures. We love to have partners who are willing to email their membership during key points of open enrollments, and we can provide the content to use for those emails. So our job is to make it as easy as possible for you to disseminate the information that we're getting out there. You can also link to Access Health Connecticut from your website, as well as share Access Health Connecticut's social media posts. We strive to be very active online and on social media. So I encourage you to not only follow Access Health Connecticut, but repost and retweet and re-Instagram, if there's such a word, our posts so that more and more people can see them. Always looking to engage with your community. And by your community, I mean the folks that you serve. Speaking engagements in English and in Spanish, we're happy to provide. We go to local and state events, fairs, festivals, sometimes community events and neighborhood level events. We provide the webinars like today. We provide informational materials. We also conduct research and surveys that help us craft our messaging in moving into the future, but also how we operate to be able to reach more and more families in Connecticut. We also conduct a series of planning sessions every year that are very important to Access Health Connecticut because those planning sessions are designed to take your input and help us shape everything that we do. If you would like us to join you in your community at an event, speaking engagement, any sort of opportunity, here's the best way to reach us. By email, if you email to the outreach at accesshealthct.com email address, it will come directly to the outreach team, and we will be able to respond and schedule ourselves and work with you to get the folks from Access Health Connecticut to you and therefore to your community. There is also a form in the community partner website, which is the one I already mentioned. You can fill that form and it will also land in the hands of the outreach team. Remember, that website, which again, I cannot repeat it enough, is learn.accesshealthct.com/community. Here are some of the resources that I've already mentioned and they really bear repeating. The community website, learn.accesshealthct.com/community. Don't forget to go there. You will see so much information that we hope is helpful to you in your work. You can also search for InPerson Help for the folks that you serve by going to support.accesshealthct.com. There you'll be able to search based on the location of your client to see what the nearest in-person help center is or a broker that they may be able to speak to. We also publish a monthly community newsletter. If you see it already, that's wonderful. If you have not seen our monthly community newsletter, be sure to sign up today. You can do it directly through the community website. And once again, educational webinars are offered for you. They're always made available even after the webinar has completed so that we can reach as many of our partners as possible. A couple of webinars that are going to be coming up on consumer shopping and decision support. We have a session scheduled for Wednesday, November 29th, also at 1 o'clock like today, and another webinar scheduled for Wednesday, December 6th, also at 1 o'clock. Guess where I'm going to point you to be able to look at those webinars? To the community page, learn.accesshealthct.com/community. Look up different subjects. We are going to continue to offer webinars beyond open enrollment as well. So don't forget to check the community page every so often and stay informed on everything that we do and everything that we offer. For contact information, here is the best way to support, and I'm going to look at it up here because it's so small. For customer support, when you need to contact Access Health Connecticut for customer-related issues, email the ird.outreach@ct.gov. If you need or your client needs help with plan selections, call a broker, and you can see the number here, which is 855-805-4325. Or of course, you can search for that type of in-person assistance on our website. For non-customer related issues, please contact the following individuals: Gina Walsh, Darwin Jurado, and when to contact them is best when any assistance that is not customer related, such as verifying enrollment outcomes, proper documentation, income, MAGI definition, and such. So these are some of the ways in which you can reach the right person at the right time to serve your customers. I think we are, okay. Coming up for the last one is I really would like to urge you, if you are not already connected to Access Health Connecticut as a community partner, please consider becoming a community partner. You can call the outreach team at 860-327-5517. You can also email us, and I mentioned it before, at outreach@accesshealthct.com. And never, ever, ever forget to reach out through our website, the learn.accesshealthct.com/community. Also, I mentioned that we like to be very active on social media. Look us up on Facebook, Twitter, Instagram, Google Plus, and even YouTube for our channel. Look for at Access Health CT. Follow us, be connected, help us spread the word through social media. Now, I'm going to move on to the question and answer session. First, let me say thank you for taking the time to be with us today. I really appreciate that you've taken the time to listen to this important information. I know that today's webinar basically it really covers all of the basic information. And I want to encourage you to ask us any questions you may have at this time. And the way to do it is to type it in the chat box, which is on your control panel. And even before we move on to the questions, I'm going to ask you for a big favor. It's actually a very small favor. In a moment, one of our colleagues is going to post a link. And in fact, the link is right up on the chat box right now. That link is a very short survey that we would love for you to fill out. And it's through SurveyMonkey. And it will give us some feedback as to how we did on today's webinar. We really want to know the good, the bad, the ugly, exactly how this is helpful to you. And it's important to do so by giving us this feedback. So make sure that you take a moment at the end of the webinar to click on that link and complete the survey. Now, we have some questions. And Shelley, thank you for waiting for my part of the presentation. We have some questions that were submitted ahead of time as well. So those of you participating today, don't hesitate to put your question up. And we did have a few that were submitted ahead of time as well. And let me ask one of those. Shelley, help me out here. Should I advise someone about what plan to choose?
The answer to that would be no. Unless you are a certified broker, a licensed broker, you should not be advising your client on which plan they should be choosing. It's okay to review exactly what you see on the screen, just identifying the summary, the numbers, but you cannot advise in detail for your consumer. So the best way to do that, just get online to our website and find a broker near you. If there's not already one in your site, and direct them that way.
Great. So the important thing to understand is that licensed brokers are the only ones empowered to give advice specific to the family situation.
Correct.
About which plan to choose.
Right.
Otherwise, the choice is in the client's hands.
That's correct.
Okay, terrific. Thank you. Thank you. One question that came up for one of our participants today is about the dental coverage. And the slide referenced Cigna as one of the providers for dental coverage. And she tells us, or our participant tells us, that they had helped a plan and only saw Anthem plans for coverage starting 1/1/8. Do we know the reason why that may be a little of a discrepancy? And if we don't, that's okay. We can get people the answer.
I think it was just a typo. We apologize for that. It is Anthem.
Got it.
So we apologize for that discrepancy.
Oh, okay. Very good. No, not a problem. We'll make sure that that's a correction that is made for any future use of the webinar. So again, just to repeat it, Cigna is not one of the providers of dental coverage. We apologize that it was on the slide. The correct provider is Anthem. Beautiful. Thank you. How do I find a CAC, which is a Certified Application Counselor, or a broker? What's the best way to do that?
Get online. AccessHealthCT.com. We have a Get Help tab. You can search for assistance in your area by typing in the zip code or the city's name, and that'll direct you to anyone listed on our website that is in your area or in that area.
Terrific. Excellent. So again, we encourage people to look it up online and do the search. I've seen this question many times before, and it's top of mind for people who serve such a diversity of clients as we serve all over the state of Connecticut. The question is, how can a consumer get assistance in languages other than English?
The best way to do that, if you don't have access to it within your site, is to call our call center. We have access to over 800 different languages. Just when prompted by the customer rep, just let them know you need an interpreter, identify the language, and we will get you connected to one of those individuals to help you along.
How many languages are available again through the?
100, over 100.
Terrific. So there really should be no reason for us to miss being able to serve pretty much every family that deserves to be served here in the state of Connecticut. Terrific. One more question I have that was submitted earlier. Can an individual enroll and get financial help if they have an outstanding tax penalty for non-enrollment?
Yes. A client may come onto the system and enroll in coverage. However, they will not be eligible for a tax credit until they reconcile their tax penalty or any fines that are outstanding. So they will enroll, but they won't have access to a subsidy until that is reconciled.
Got it. So if you've been on the exchange before and you have not, let's say for the year prior, and you have not reconciled through your taxes, what the financial assistance was for you for the financial help, again, the answer is yes, you can enroll, but you cannot access that financial help again.
Correct.
Until that reconciliation is completed. Right. Okay, that I can see how that can definitely be confusing, and we want to encourage people to to be clear about it and make sure that they've taken all of the steps that they need to be sure that they are covered. I want to give another opportunity for any one of our participants. If you have any questions, type them in the chat box. And at the same time, while we're doing that, let me encourage you again. I cannot tell you enough how important your feedback is to us. In one of your questions, you already caught one of our errors, and we apologize for that. But we want you to tell us just how you felt the experience of this webinar was for you, and if it was helpful in any way possible. So don't forget to take the survey. You see the Survey Monkey link. It's in the chat box. Take a moment and click on it, and take a moment and click on it, and make sure that you give us that feedback. All right. I'm waiting to see. I don't have any other questions. I'll point you again to the Survey Monkey link. And I think that with that, Shelley, we can close the webinar. Yeah. Oh, yes, we do have one question coming in. Thank you. From one of our participants. Can you please clarify what would be considered a customer-related issue versus a non-customer-related issue, or when we should use IRD outreach at ct.gov versus contacting Gianna Walsh? That is a great question. Let's give an example of what a customer-related issue and one of a non-customer-related issue.
Customer-related issues, anything with your consumer about their application, or maybe the determination on their on the website when they submitted it, that would be customer-related. We like to kind of direct any kind of those issues to our call center so they can be addressed properly and not kind of flood reach the wrong channel and have to kind of delay the resolution. So customer-related issues, anything dealing with the consumer, their application, their account, the outcomes, any questions like that should be going to the call center first. Non-customer-related issues is anything going on with you as a CAC or community partner. If you have questions about how you can get involved, or something with your certification, or maybe you have new hires and they want to become involved and you want to certify them At that point, it'd be considered non-customer related issue. Uh, for certification, that should go to Gina Walsh. She handles all that, and she's a great resource for the CAC community. For IRD outreach, I'm going to table that. We're going to have to take that one back just to clarify what sorts of issues should be going to that email inbox. But Gina Walsh is your CAC contact, and for anything related to certification, or if you need more materials for your community center, she's a first stop, a great resource as a first stop. So we'll get back to you guys about the IRD outreach inbox.
Okay, terrific. Absolutely. We can research and make sure that we have the right answer for everyone. One of our organizers, not organizers, I apologize. One of our participants does not seem to see the link to the Survey Monkey. So I think we're going to link it once again. Any other questions? Please let us know now, or we'll be ready to close today's webinar. But I won't do it until I know that you've had plenty of opportunity to click on the Survey Monkey link and give us your thoughts. Again, I really appreciate Access Health Connecticut, really appreciate your partnership, and we hope that we have many more years of serving our communities, serving your communities, by establishing these partnership relationships and making them always fruitful. Okay, with that, then I'm going to close the webinar. Never without saying again, thank you. Thank you for your time, your participation. And as I said before, this webinar has been recorded and it will be available through our community website, as well as it will be distributed to those who've participated for today. Thank you very much. We appreciate it. Thanks from Access Health Connecticut. Have a great afternoon.